Today we will be talking about social media's role in mental health. First, we'll start with a brief timeline of social media's emergence into the mainstream, then some of the first evidence of how this played a role in how we socialize and construct our mental schemas of ourselves and others, today's evidence of the negative effects it could have on mental health, why it's important to study this impact, and possible solutions. Research from Maryville University suggests that the development of social media sites began in the 1970s and 80s, with 1997 Six Degrees profiles being the first of its kind to involve online communication and profile creation. This was followed by Friendster in 2001, and then the boom of MySpace in 2003, followed by Facebook in 2008. In 2006, MySpace was the most visited website on the planet, and this completely changed the way that we communicate with others in our social environment. Coin et al. Began an 8-year longitudinal study in 2007 with adolescents aged 10 to 13. They studied their social media use and rates of anxiety and depression. Results found that increased social media use time was related to increased rates of depression and anxiety. Research from the past year has shown that why individuals are motivated to use social media is directly affected to mental health outcomes and overall satisfaction from social media sites. A clear example is doom scrolling. In the 2019 COVID pandemic, young adults experienced increased depression and PTSD symptoms when they had a daily influx of pandemic-related news and information. So, why should we care about social media's impact on mental health? Well, we use social media for a wide range of functions. For instance, Zoom, Teams, and LinkedIn are both academic and professional contexts in which we use social media to advance our career and our relationships with others. It is very important to develop healthy habits and an overall strong relationship with social media in order to improve our mental health. As social media sites evolve and the use of them become more prevalent in modern day society, Harriman et al. Suggest that reducing our exposure to social media sites can have improvements, and also social media literacy programs, which highlight the negative effects of social media, can reduce the likelihood of having increased anxiety, depression, or PTSD from social media site use. To summarize, social media is gaining more and more prevalence in our modern day society, and we must be educated on its impact on individual mental health in order to develop a healthier relationship with our social media sites in our academic, personal, and professional